London City. Hello.
More women taking over the world.
Wonderful.
As of 2019, 11% of adults deal with depression and anxiety. In 2021, that number has risen to 41%. 56% of adults aged 18 to 24 experience anxiety and depressive symptoms. In the Philippines, a study has shown that over the pandemic, 16.3% reported feeling a moderate to severe psychological impact. 28.8% reported moderate to severe anxiety symptoms, and 16.9% reported feeling moderate to severe depressive symptoms. Only 44% of those who suffer with mental health issues have received treatment or counseling. People are feeling more isolated more than ever as the pandemic keeps them away from their friends and family. It can be hard to find the help you need. Consulta MD is your partner in overall health, both physical and mental, because we know that your mental health matters. Mental Health Matters aims to serve those who are in a dark place and bust the stigma around mental health. We want you to know that you matter and that your mental health matters and that we are here to help. Seek help. Download the KMD app, talk to a professional because we want to help you.
Hi, good morning. Thank you for calling Consulta MD. This is Dr. Tan speaking. May I know who's on the line, please? Yes, ako po. Ako na po ang doktor. Once you press 1, doktor na po ang kausap nyo. Hi, Carla. How can I help you again today? No, don't worry. You can consult us as often as you want. Unlimited ang Consulta MD. Hi, Carla. Yes, ship ko pa rin. Ganito kami ka-dedicated. No problem. You can call anytime, 24/7 naman kami. Yeah, don't worry. We're always here for you. Get 1 year of Consulta MD for only 499 pesos. I-consulta mo na yan. Download the app now.
Consulta MD offers medical and healthcare advice when you need it through 24/7 online and hotline consultation.
We, your doctors, are always in, always available, and always online.
No appointment needed. Talk to a doctor immediately. It's affordable and unlimited. For as low as 60 pesos a month, i-consulta mo na yan.
I-consulta mo na yan.
Bringing you the most immersive Consulta MD experience by putting you right in the doctor's office through your TV screen. Experience doctor consultations with a new Huawei Vision S TV from the comfort of your home. Here's how. Click on Consulta MD in the app gallery. Input your mobile number to register. Create a PIN specific to your account. Once your profile is created, go to Talk to a Doctor in the homepage. Click on Video Consultation and wait for the doctor to enter the room. Get 2 months Consulta MD for free for every purchase of the Huawei Vision S TV. Upgrade your TV experience. Upgrade your life. Upgrade your healthcare.
the way from LA, Curtis Smith. The one and only. Ben. Trending on Twitter right now. Woo! Congratulations to everyone.
And don't forget to download the Consulta MD app. Super easy, and there's free mental health consultations 24/7.
Yes, till October 31. It's free, guys. Free. She needs no introduction. The one and only Nadine Luce.
Come on and make me say
Let's all help raise awareness for mental health. Good night, everyone.
I want to see the future. I want to build the future. I want it to be big, bold, brave. To go further, faster. To make the impossible possible. I want to be where the generations of today build the solutions of tomorrow. Investing in cleaner, greener, kinder, smarter innovation. Harnessing the sun, the sea, and the wind. Turning the elements to power. On a grand scale. I want to go where innovation saves lives. Rebuilds lives, creates life. I want a future built on the shoulders of giants, on a heritage of ideas. It's going to need the right environment, high impact, high value investment. World-class skills. A global vision. I've seen the future. And it's here.
It was once all about the race. If you weren't ahead, you were out of the game. But when everything stopped, we saw the chance to change the game and begin a new path. This time, the bottom line won't be our finish line. This time, we'll chase investments whose real interest is care. This time, every step we take doesn't just change the world, but protects it. This time, our tech advancements will propel human betterment. This time, we will run the longer race. Because the most rewarding pursuit is leaving a world greater than what it is.
Good afternoon, mayors, ladies and gentlemen, and welcome to our fourth Livable Cities Lab for 2022. Our topic today will be digital health, data and analytics for a better public health system, presented together with the British Embassy Manila in partnership with the League of Cities of the Philippines and Globe Telecom. Advancement in technology and digital innovation will have great impact in the field of medicine and healthcare. The use of digital technology will enable telehealth, telemedicine, health informatics, and data portability, better health surveillance, and overall better pathways to wellness. Effectivity of these technologies, however, is contingent on accurate, complete, and reliable data and information systems. Medical practitioners, including researchers, scientists, and policymakers, rely on these data and analytics to develop the right formula and approach to healthcare, public health policies, and health emergencies. These data must be turned into useful information as a basis for policy and development interventions. Policymakers, national agencies, and local governments will also need the information to craft and implement the necessary reforms and measures for improved healthcare delivery and services. Today's Livable Cities Labs will look at digital health as a way to better manage future pandemic and other health hazards, address illnesses, particularly non-communicable illnesses, diseases, and promote health and wellness. In a post-pandemic Philippines, the use of data and analytics and ICT in medicine and other health practices is critical in strengthening our communities and building better public systems. Today's speakers will include Dr. Dennis Batangan of the UK Better Health Program, Philippines, Grace Anduiza of Consulta MD, Roger Salazar of Healthcare Information Management Association of the Philippines, or HIMAP, Alistair Bullard and Richard Irvine of NHS Digital, and Mayor Lino Cayetano of Taguig City. I'll properly introduce them just before each of them speak this afternoon. But before we begin our Livable Cities Lab, let's go through a few safety reminders. First, be aware of your surroundings while the webinar is ongoing in case you need to stop for an emergency. And second, always stay safe and practice social distancing even if you are out of your home. Furthermore, this webinar will be recorded and will be available on the Livable Cities Facebook page. Questions may be asked in the Zoom Q&A chat box, which includes a feature that allows the audience to vote on questions posted by others by simply clicking on the thumbs up icon next to the question. Some of these will be answered directly by our speakers or their staff in the chat box, while other questions may be parked later for discussion in the open forum. If you are joining the webinar on Facebook Live, you may place your question in the comments section of Facebook, and our staff will pick it up from there and relay it to us in the Zoom room. At the end of this webinar, we will invite you to please fill up our feedback survey. Your response will help us improve our Livable Cities Lab series, and you may also get a certificate of participation by answering the corresponding questions in the survey and a special premium service vouchers that go with today's survey. So to get the program going, and all throughout this program actually today, we're going to be asking all of you a series of poll questions. And we will ask these questions from time to time throughout in between each speaker's presentation. So before we proceed, note that the identity of all poll participants is confidential and that the poll does not gather any personal information. So let's try the first poll question. It's a very simple one and a standard one we ask at every Livable City Lab. And the question is, where are you joining us from? Where are you joining us from? Just one choice: Metro Manila, rest of Luzon, Visayas, or Mindanao. So where are you joining us from? Metro Manila, rest of Luzon, Visayas, or Mindanao? So let's give a few seconds for people to answer. Okay, here we have the answers. 26% Metro Manila, 42% rest of Luzon, so that makes 2/3 from Luzon. And then we have 22% from Visayas, 11% from Mindanao. So 1/3 from Visayas and Mindanao. So at least now we know where we are all coming from, no? Okay, let's try a second question. Do you think that your LGU is now more prepared should another pandemic or health crisis strike? Okay. Do you think that your LGU is now better prepared should another pandemic or health crisis occur? So the answers are yes, because of the experience from this pandemic, meaning COVID-19. Second, we need to be more proactive. And third, no, because we have lack of resources. So, do you think your LGU is now better prepared should another pandemic or health crisis occur? Yes, because of the experience of this pandemic, we need to be more proactive, or no, because of lack of resources. Okay, so, well, the good news is 42% say yes because of the experience from this pandemic. And I think there's a lot to learn from the different LGUs, the cities, the municipalities, and the national aid government agencies and the private sector, what they did to, to learn what lessons they extracted from the pandemic. But 48% still feel we need to be more proactive. And then finally, just 9% say no because there's a lack of resources. So overall, it's a bit of the positive side, which is great. But the idea now is let's take this opportunity to learn from each other and exchange, I guess, lessons and insights. So thanks for taking the time to answer these questions. We're going to come back to you and ask a few more questions as we proceed through the program. So let's start with the first speaker. Dr. Dennis Batangan is a health social science researcher and a public health specialist. He's on the faculty and is a research associate of the Ateneo de Manila University with external appointments from other universities. The products of his research teams on e-health technologies have been granted a utility model registration, and he has a pending patent application. Since 1987, he has conducted studies on Filipino-oriented health systems, indigenous knowledge and practices on health, community-based social health insurance schemes, human resources for health, information, communication, and technology for health, and access to medicines in developing countries. In 2021, Dr. Batangan's research team received awards from the Philippine Department of Science and Technology for Technology Adoption and Promotion Institute, and the Filipino Inventor Society the Bronze Award in the patent pending category for the eHatid System 2.0. Dennis is going to present his work on digital transformation for local health information systems in the Philippines. Let us all please welcome Dr. Dennis Batangan. Dr. Dennis, over to you.
Yeah, thank you, Bill, and good afternoon, everyone. No? Thank you for that generous introduction. So I'll start sharing my slides now, no, for my presentation this afternoon. Actually, the topic that was given to me in terms of the presentation, actually, in a sense, links, no, to one of the livable cities topic, and I attended that in October 2021 on local financing, no, by Attorney Alagra. And I would like to relate the topic, that particular topic. That's why the topic here is in local autonomy and local health information exchanges in the era, in the universal healthcare era. So as mentioned, I work with the UK Better Health Program Philippines and also with the Ateneo de Manila University. So for this afternoon, the main areas I would like to cover are the following: to provide an overview of the universal healthcare, and of course, related to that is the Philippine digital health landscape. And then I would move on to the implications on the developments on local autonomy to digital health, no, because we're seeing a lot of this moving quite recently, especially with the universal healthcare. And I will be presenting updates on the work that we're doing on local health information exchanges, including the work on non-communicable disease that we're doing for a Better Health Program, which is a new application for NCD reporting in the Philippines. So to start off, most of you probably have seen this diagram of universal healthcare. And what I would like to highlight in this slide is the role of e-health, no, in the universal healthcare implementation. And e-health actually is under the governance pillar. Now, again, to highlight the fact that although it's the focus is on technology, the way it was framed under universal healthcare is that it is part of the governance pillar, no, of universal healthcare. One of the main reforms introduced by universal healthcare is what we call this province-wide and city-wide health systems, which is actually a move towards further autonomy of the health systems. No, what you will see here, no, under the Department of Health, is that there are dotted lines in terms of the relationship with the Department of Health and the provinces and cities. Meaning, it is actually the province and the city through their province-wide and city-wide health systems who are, in a sense, entrusted to implement the health system, the health program in their particular jurisdictions. And what do they need to do? No, I think very tall order, no, for our LGU partners. No, they need to implement their health programs. They have to manage the health system, and they have to integrate them. No, ito yung areas ng integration, no, managerial integration and financial integration. And you will see here that what is being asked, no, from the LGUs is very, very complicated, no, and very because they're asked to manage, to consolidate administrative, technical, managerial functions within the context of their, and that's, I think, this is where ICT comes in, no, where information communication technology comes in to be able to be part of that particular tools, no, for managing the health system. What you see here is a very busy slide on how the healthcare provider network, as provided for in the universal healthcare, looks like. No, this is the, kumbaga, ideal, no, no. So the first cut is actually eligibility, no. So it means that kung universal yan, all Filipinos should be a member of PhilHealth, such that if you are a member of PhilHealth, yung nasa gitna, you'll see in the middle, ito yung citizens natin, no, yung eligible members of the, they have the option of going through public or private service providers. And from these public or private primary care providers, they could be referred to secondary, tertiary, or even other types of services within the network. And for all of this to happen, ang laki ng expectation at saka ng role ng ICT, information communication and technology, no, and not only that, no, the health system implementation, what you see here, yung service delivery, human resources, information, etc. These are the building blocks of the health system. Again, expected to be implemented as part of the local health system. So, what has been the preparations done, no, in terms of how the country or specific implementation sites could proceed to universal healthcare? In around last quarter of 2020 yata yun, no? Yeah, fourth quarter of 2020, or during that year, no, 2020, there was a national study on local health system maturity levels. So these are the key result areas. And one of the key result areas is information management system. So the results of this, this study included these bar graphs, no, wherein the LGUs were given some kind of a scorecard, no, where they are in this particular key result areas. This particular result is actually for Cagayan de Oro City, one of our pilot sites for the local health information exchange, which I will explain in a bit later. No, under that key result area of information management system, there are several items that were listed here, no. Just like to highlight here yung role, yung item on validated EMR system that links members of the primary care provider network to secondary and tertiary care providers within the province or citywide health system. So essentially, this is a local exchange, no, that is being envisioned, this particular requirement. So what we're seeing, no, with this implementation of universal healthcare, and of course, it's not happening in a vacuum, no. There are other mandates like the Philippine ID System, Data Privacy Act, even the IATF, and then the recent Mandanas CRCA ruling, and other UHC issuances from UH and PhilHealth, which actually has reframed the health information system, such that we're moving towards a more localized type of a model. No? So now we have the previous design for this system is the Philippine Health Information Exchange. We are now seeing more and more of local health information exchanges being linked to that Philippine National Health Exchange. This is an example of an open health information exchange. Now, this is a very generic design. No? You will see this in almost any open HIE. And what I'd like to highlight here, no, is that in this particular health information exchange design, the possibility of other softwares or modules, no, including the MUFLONC, which I will describe in a bit later, which is an NCD recording and reporting tool, to be integrated into the exchange. No? And as far as the universal healthcare law is concerned, this particular exchange or this particular system should be managed by the LGU. No? Either they contract out services, or they develop their own, or use the DOH prescribed system. No? Just a brief background on the Better Health Program in the Philippines. We have 3 pillars. The first pillar is on the NCD policies, no, and we're focusing on gestational diabetes, clinical pathway, and health technology assessment training. The second pillar is on education and training, wherein we are working with local learning networks. And the third pillar, which is my area of concern for the BHP project, is the assistance to LGUs. We have 2 LGU partners, Pasig City and Iloilo City, on NCD recording and reporting. And that's the multi-program local mapping tool. This is how it looks like, screenshot, no? So it's basically a electronic NCD recording and reporting for local government units, but still in the pilot phase. It has a dashboard, patient registry, and also has reports. And this is a sample of the report that's being generated for the field service health information system. So lastly, no, this is the last slide. No, the local health information exchange model that we're working on with the Department of Science and Technology in Ateneo and local government, particularly Cagayan de Oro City, for our city model looks like this. No, wherein this technology is already deployed in Cagayan de Oro, and we're looking at the integration of other softwares, no, and modules into the system in the coming months. A similar province-wide level model is actually being implemented or piloted also in Pangasinan province. So I think that's it for my presentation. And this is just some of the dashboard information that can be generated by Smileys. We just started actually with the hospital beds as one of the use case, no? Number of hospital beds in the city as one of the possible use case for Smileys Cagayan de Oro. So thank you very much, and good afternoon, everyone. Back to you, Bill.
Yep. Thank you, Dennis. So I think what we're picking up from your presentation, Dennis, is the importance, actually, of a critical role that technology and ICT and health information will play in the new universal healthcare system. And it's going to be, I guess, a heavy burden will be placed on LGUs. So LGUs have to be ready as far as the technology, the ICT is concerned. That's correct, no?
Yeah, right. Thank you.
Yeah. Okay, no, that's perfect. So that's perfect as a lead-off topic for us, Dennis, because we're gonna try to take a deeper dive into this, and hopefully a lot of questions will come up in the course of our discussion. So thanks, Dr. Dennis. Now, just a reminder to everybody that please feel free to send in your questions to the Q&A box, and you can hit the like button, and if you like the question, so that it'll prioritize the questions later on during the open forum. Now let me ask another poll question, okay, kind of now related to what Dr. Dennis just said and what's going to be leading up to our next question, our next topic. The question is digitalization for public health service. No? Do you think that digitalization played an important role to enable the government to provide public health service during this pandemic? Now, we're not looking future tense, we're looking right now. Do you think that digitalization played an important role to enable the government to provide public health service during this pandemic, meaning COVID-19? So you have one choice. It's either yes, no, or I don't know. Okay, so did digitalization play a role today? Oh, well, this is interesting. 98% of you feel that digitalization played an important role to provide public health service during this pandemic. So clearly, just 2% don't know, and nobody said no. So clearly, there's already some form of uh, digital health practice at work in today's health system. And now we just have to build up and improve on it over time. So let me move on to our next speaker. And so uh, one from the overall big picture of the use of health information and uh, technology in overall public health care, let's take a look at one aspect, which is the e-consultations, no? Which has been I guess, a growing practice here in the country because of the lockdowns. Our next speaker is Grace Anduiza, the Chief Revenue Officer of Consulta MD. Grace has had 18 years of experience in the telco industry. She started her career in extensive sales across different areas of the business, from consumer to B2B, with focus on the small and medium enterprise segment as her latest stint before moving to Consulta MD. Her area of interest has always been business development because of how it satisfies her curious and inquisitive nature. So this is a growing field, and as I said, something I think that we've seen expand rapidly, as we saw with all digital transformation activities over the last 24 months since the onset of the declaration of lockdowns due to COVID. So let me invite Grace to speak all about this all-in-one health app for evolving health demand. Let's please welcome Grace Anduiza of Consulta MD. Grace, the floor is yours.
Good afternoon. Thank you, Bill, for that introduction. I'm Grace Anduiza. As you have mentioned, I'm the Chief Revenue Officer of Consulta MD. So what I'm going to talk about is not just the app itself, but also what we've been doing, the initiatives that we've had and will continue to do with the LGUs and the other corporations, and how we can inform everybody about the different options that they can have on consulting, not just as face-to-face, like personally, but also the emerging e-health, the teleconsult business. Okay, so to introduce ourselves, we are Consulta MD. And what we do is we are the future of health tech. Consulta MD is the largest telehealth company in the Philippines. We provide 24/7 access to medical information supported by a team of licensed Filipino doctors. Consulta MD is a partnership with between Salud Interactiva of Mexico and Globe. So yeah, can we move the slide, please? And so that's what I mentioned earlier, is we are the future of health tech, and we are already in that space. And in fact, we are the largest telehealth company in the Philippines. So next slide, please. Consulta MD is a telemedicine service that provides access to skilled and licensed Filipino doctors. So you get to talk to a doctor immediately. You don't get turned over anymore. So upon access of our app or through voice, you can already talk to a doctor. The doctor can provide you with medical advice, general health information, and guide you through proper medication. Aside from that, we also provide e-prescription, e-laboratory requests, e-referrals, and e-medical certificate. And we've also acknowledged the need that we don't just have to take care of our physical well-being, but we also have to focus on our mental health. And that's why we are currently focusing on mental health support and how we can advocate and let everybody know that this is something that we should really look into, especially what we've been through the past 2 years and what we will continue to go through probably as we recover in the coming months. Next, please. What makes us unique? Of course, we're fast, we're affordable, and we're here 24/7 to support you with whatever you need, especially in your health concerns. Okay, next is we have partners in over 20 industries. Partners as them being able to help get Consulta MD to you much faster, easier, so you can access or purchase Consulta MD subscriptions from any of our partners. Aside from that, we've also partnered with the different companies. And that's important because we want to make sure that those companies that do not have medical or adequate medical support for their employees will now have access to that. And it's going to be affordable, especially for the SME segment, because of course, you know how tight the budget is within that particular segment. And aside from that, especially with the big companies, we want to complement and optimize the existing health benefits that they currently get from their companies. Moving forward, Consulta MD, we can say, as we've had consistent and strong partnerships with the Department of Health and the LGUs. And I think this is what we want to focus on right now. So at least you will know it goes beyond just us advertising the platform, but we're also partnering and really making sure that we are present and we are here to support the requirements of our citizens. So we can start with the executions that we've done. Next slide, please. We've had a partnership with OWA, where we offered free telemedicine service to all returning OFWs that were quarantined in the OWA facility. I think one of the offers that we have shared is for support for mental health. So at least when they come home, it's they have somebody to talk to help them process whatever it is they're feeling. So at least while they are on quarantine, they know or at least feel comfortable about what they can expect and how to manage whatever emotions are going through. And aside from that, talk about their health as well. And we've also had a DOH partnership where we gave free consultation through a DOH volunteer doctor. It was very easy. All you had to do was download our mobile app. And for those of you in the audience, we would like to encourage everyone to download our mobile app so you can find out more about the services that we can offer that go beyond just, having that initial conversation with the doctor. So you download the mobile app, and then from there, whoever accessed it can already talk to a doctor, and they can find out, and they can have that consultation and really try to find out what's going on. Next is, and this is something that we are very excited about. We've run a POC, a proof of concept last year. We've done it with two, Sorsogon and also Kawayan Isabela. So this is a proof of concept that we've executed to support a pain point. The pain point that the LGU was facing is, of course, there's a shortage of doctors, and of course, making the consultations affordable, and making it accessible for everyone, where they don't have to travel to get to a doctor to make that consultation, because it does eat up a lot of time. And that is something that they would like to offer to their constituents. So what we've done is we've actually bundled Globe Duo enabled handset plus a basic diagnostic solution where the constituents can just, the citizens can just go, try it out, check their blood sugar, check their blood pressure, and then from there, the information gets stored into the system, and then it can go to our doctor, where they can have a face-to-face consult already to try to find out a little more about the results that they were able to get from their initial consultation or the tests that they've done using the basic diagnostic solution that we've provided. So this is something that we are really excited about, because we want to continue working to understand the evolving needs of our citizens. And in doing so, we can address and support them accordingly. So having a proof of concept is really something that we would like to not just do with these two places, which is Sorsogon and Kawayan, but we are open to also extending this to other LGUs who would like to partner with us for us to, do that proof of concept and see if this is something that they would like to pursue for their municipality or their local government unit. Next, please. So there, just a few pictures to show you what we've been doing. So this was done 2020 and up to 2021, and there are continuing initiatives and activities that we're doing, and it will continue over the next few months. So we'd like to invite all the other LGUs. If you're interested, please do get in touch with us. Next, please. So as with most apps or as with technology, a lot of people are afraid that they might make a mistake or it might be difficult or it might be hard, especially with a certain demographic. Those that are not, the term is, hindi ako techie. Hindi ko alam paano gawin yan. Natatakot akong gawin yan, baka magkamali ako. Ano pang mangyari? So what do we want to show you? We want to show you how easy it is to download our app, how easy it is to register, and how easy it is to access a doctor in just maybe 4 or 5 steps. So as I mentioned earlier, I'm encouraging everybody to download the app. It's you may download the app. It's for free. App Store, Google Play Store, and also Huawei App Gallery. So once you've downloaded it, all you have to do is enter your mobile number and sign in, create your profile, and there you go. You're already registered in Consulta MD. Now all you have to do is take that next step. Do you want to do a video consult with your doctor? Do you want to do an initial consult? Or is there a voucher that you can input so you can start using our service? In fact, after my talk, we will be giving vouchers for everybody for mental health. And as I explain more about mental health, at least we can give you a trial, or you can find out more about it yourselves and appreciate what it can do for you and maybe your family members, your citizens, and everybody. How important, and show you how important it is to take that first step in taking care of your mental health. Next, please. So there, these are just the steps. Since we will be sharing this file, at least you could see that there are several options how you can talk to our doctor. There's unlimited voice calls. You can also do a video call. And it's not just the primary care doctors that you can get in touch with, but you can also select a specialist should your requirement be more than just the initial checkup or consultation with our primary care doctors. So there, all you have to do is make that call, and then you can start the consultation. You already get directed to a doctor. So there you go. I have 2.5 minutes. Yes, thank you. So go ahead. So this is just, we're just showing you the different steps on how you can access Consulta MD. So moving forward, please. So we want to focus more about mental health support, and we want to talk about it now. This is something that we should already start considering and be mindful about. And we shouldn't just focus on our physical well-being and our physical health, but also focusing on our mental health. And this is where we come in, and we'd like to offer our mental health support. It's really okay not to be okay. We have to start acknowledging and get past that stigma na nahihiya ako na malaman ng tao that I am consulting a psychologist or a psychiatrist because, they might think I am not of sane mind. It's not like that. It's just helping you manage your emotions, take hold of it, and really try to find out how you can get past whatever it is you're going through. So what are the plan benefits? It's available 24/7. You can talk to a licensed psychologist. There's no appointment needed. And it's through a video consult. So at least you get to see the psychologist as you are discussing, and it makes you more comfortable to discuss whatever personal issues you have. So that's the benefit of actually making use of our mental health support. So there, let's move on. So yeah, very clearly, why partner with Consulta MD? As I've mentioned, we're the largest telehealth company in the Philippines with more than 1 million users, and then it's continuing to grow. And also, it would be a good initiative and step for us to start partnering together so we could learn more about you and you can learn more about us. So at least, we can understand your needs better. And with understanding those needs, we can also come up with better solutions that can help you with your requirements. So there you go for Consult the MD. And just to remind everybody, we'd like to invite everybody to, aside from downloading our app, please register, because upon registration, we can now release the vouchers for your free mental health support voucher that you can try out and see for yourself how it can help you. You never know, by taking that first step, you'll have a better outlook, or you'll be treating 2022 so much better than, the previous years. Thank you.
Okay, thank you. Thank you, Grace. Wow, you do a lot in Consult the MD, I must say, huh? So I learned today that if you call, you get direct access to a doctor. You have now you have mental health support that you give. You've taken the old Doctors to the Barrios program and created a virtual Doctors to the Barrios program. And I see you've done it in Sorsogon and in Kawayan. So I think for LGUs looking for partners, the Sorsogon, I suppose, is a provincial level, because I noticed the message came from Governor Chis Escudero, and the Kawayan is a city level partnership, because I noticed the message came from Mayor Bernard D. So yeah, I hope people consider you and consider Consult the MD for a partnership. So thanks, Grace, and I think we'll get back to you with a lot of questions. I see a lot of questions coming in to the Q&A box now, so that's great. A lot of interest. Now, let me move on to our next topic, and I think some of you may be a little surprised that actually we're going to move from the domestic application of digital health to the global or international application of digital health. And some of you may be a bit surprised, actually, that this has been a practice that's been ongoing for a number of years in the Philippines through our business process outsourcing industry, the BPO industry. So our next speaker represents that industry. And so I thought of inviting him to join us, So Roger Salazar is currently a member of the board and former president of the Healthcare Information Management Association of the Philippines. So let me repeat that. The Healthcare Information Management Association of the Philippines, or HIMAP, H-I-M-A-P. It is the Healthcare Business Process Outsourcing Association that forms part of the larger IBPAP, the whole BPO industry. So it'll tell you right away that this is a global industry with Filipino professionals providing a service support to international clients in the area of health information. So prior to this role, Roger was president and country lead for Optum Global Solutions in the Philippines. He's had over 30 years of experience in various industries, not only BPO, but he's been in manufacturing, food processing, and export agriculture, not only in the Philippines, but in Indonesia, Latin America, and the United States. Now, Roger, I've had the privilege of working with Roger under Task Force T3, Test, Trace, and Treat, which is the private sector's COVID response support program for the government. And it's through Roger that we've been able to recruit actually healthcare workers from his industry, the BPO industry, to help in vaccinating the public, through LGU. So we've already had a partnership in that side, but now I've invited Roger to speak about healthcare information from a global perspective. So let's turn over to Roger, and let's welcome Roger Salazar. Roger, the floor is yours.
Thank you. Thank you, Bill. I hope everyone can see my screen. Yeah. Okay. So first and foremost, good afternoon to everyone, and thank you for the opportunity to be part of this session today. When Bill spoke to me about the opportunity to speak when in the major theme of livable cities. I was very excited when he mentioned that healthcare or healthcare security is a major component of that. There were other components in the Livable Cities program, but it's good that we are looking at healthcare as an important component. And the series today, or today's session, is really focused on healthcare. Wanted to share with you our information from the Healthcare Information Management Association of the Philippines. Just as a little background, we are part of the business process outsourcing industry, which generates about 8-9% of the GDP of the country, out of maybe 1.2% of 1.5% of the population. So we have about 1.4 million approximate direct workers in our industry, but we generate about 8-9% of the country's GDP as an industry. And it continues to grow. During 2020, our subsector, the healthcare sector, grew at 4%. Last year, it grew, would you believe, at double-digit rates. And this year, we expect it to grow even further, as many of our clients and the countries we serve are starting to ramp up their economies. We wanted to share that as a point of view because we wanted to be able to provide a point of view, something for everyone here to consider on how healthcare is being done in other countries. And there may be some opportunities for us to look and learn as we move, look at this healthcare journey for the Philippines. So we all know that our vision is looking at affordable and quality healthcare. We look at the different economies. We look at in the Philippines in general. We have an aging population, primarily aging, and that could be varying degrees depending on what country you're looking at. In more developed countries, that is more pronounced, but in younger countries, you see people in their 60s, in their 70s, still living very healthy and active lifestyles as compared to folks in their 60s and 70s 20, 30 years ago, right? We're also looking at providing more efficiency, more transparency in the process of healthcare. We see an opportunity there to streamline, to do things faster, better, and cheaper, which leads me to cost. And this is where the digital health comes into play, because we believe through digital health, we can reduce the friction costs. We can reduce the cost of healthcare. We look at the cost of healthcare as the cost of administering the healthcare and the cost of the medicines or the cost of care. That's going to be important. The other point that we realize over time is that we have an opportunity here to really personalize, make it more designed. We've learned all, and we've read about designer medicine or designer drugs that's customized to a particular person. You have that in varying degrees and various forms. And that's also an area worth looking at. Again, a proactive care portion is more focused on population health management. You do pre-screening for diabetes, for instance, to know whether someone who has from your family relatives, you have a history of diabetes. You can do pre-screening to be able to approach and handle diabetes at an early stage, so that it becomes better, the lifestyle of the person as you move on. So these are some of the goals and visions we have. What I wanted to share with you are the different key stakeholders. And I know Dr. Dennis talked a little bit about this already. There are many different components when we look at telehealth and telemedicine. Obviously, consumers, the patients are on the top left there. That's one area. The other areas are the physicians and our doctors and the care providers. Another group we have are the hospitals and the health systems in different parts of the Philippines or different parts of the country. And then, of course, you have the employers, primarily private sector, who are providing, different programs for their employees, looking at making things better for them, looking at improving their satisfaction through better health and wellness programs. You also have the pharmacy groups, which are the life sciences groups, for providing the medicines, providing that through the medicines themselves and also through the distribution channels. And then, of course, in the bottom, you have the payers, which are primarily the HMOs, the healthcare maintenance organizations. We have many of that here in the Philippines. We also have, though not very pronounced in our economy, we have senior living and post-acute treatment. Most often than not, senior living in the Philippines is primarily done because of our closely knit families and extended families. We tend to take care of our seniors. We handle it a very different way, maybe more along the lines of our values and our culture, which is fine. And then lastly, we have the pharmaceutical providers or the clinical research outsourcers who do the research and the clinical trials for new medicine in the markets and all that. All of these telehealth goals, we're really looking at, like I said, efficiency, cost improvements, better outcomes, and better coordination. Now, coordinating all these different stakeholders is not very easy. You've seen some of the materials from Dr. Dennis that he shared earlier in the diagram, where he discussed the different parts of different stakeholders in healthcare and how they work together. It's not very easy, I will admit, and continues to be a challenge to this day. Just wanted to give you an example of certain parts of global digital healthcare. I wanted to cite a few markets here. We have telemedicine. This is not exhaustive by any means, but it just should give you a pretty good idea. So we have telemedicine, we have patient monitoring devices, and of course, healthcare assistive robots. So I'll start with telemedicine. As you can see there, see here in the United States, this is a 45.5 billion market, but it's positioned to grow over the next few years at about 19% compounded annual growth rate. You see the opportunities there for chronic diseases and tech advancement, but at the same time, there are concerns on data security and privacy that continues to be one of the challenges in telemedicine. Patient monitoring devices, you've had this, and from the simple Apple Watch that people use to other telco companies provide this to be able to monitor your blood pressure and all that. They've taken this to another level. We've seen other companies provide a patch that can monitor your glucose levels, as an example, and how they've been able to track. This is also another growing market, currently at about 19.5 billion, or this was in 2018, and they're looking to grow to about 5% per year. And lastly, here you have healthcare assistive robots. Just an example, it's a very small market for now, 259 million in 2017, but it again is positioned to grow significantly to about 1.2 billion. There's just a huge opportunity here, especially for our seniors, also looking at people who've had strokes and many other opportunities. But this is continuously evolving and continuously learning. The cost, the use of these robots are still being developed. And obviously, because it's still at a very small stage, it's very expensive. So it will take some time before it finds its way to mainstream. We did talk about global digital healthcare. We talked about the sensors that we were using. That it can be used in many different parts, whether it's used in the clinics, in the hospitals, whether it's used in the home, it's used for chronic care management, and of course, for mobility, right? In the past, we'd have to take our blood samples every once in a while. We had to monitor our heartbeat, our blood pressure every once in a while. But with current devices now, you can actually track that throughout the day. You can track glucose levels throughout the day. You can track blood pressure and what have you. It becomes a more dynamic and more interactive understanding of healthcare. These are just some of the examples of where technology has really evolved, and it continues to do so. Admittedly, there are many opportunities for learning and improvement. So the way medicine has used technology has been very, very, very careful and yet still there's still a lot of situations that happen, right? So one of the important things you will note is that, and I know prior presentation by Dr. Dennis and Grace talk a little bit about the integration of information management systems. I think it's going to be very important, not just for connectivity when you connect population health management, you talk about preventive care to actually remote care and enhanced healthcare. It's important not only for connectivity, but to have a common data base. Okay, when we talk about that, we're talking about electronic health records or EMR or electronic medical records. When records are digitized, when your health records are converted to digital data, it becomes so much more easier to facilitate the coordination and the integration of systems. Whether that's the medicines you take for a certain illness, whether it's a consultation you did several years back with a doctor, whether it's a medical procedure that you're planning to take. If we had that all as digital data, it would be very easy. Now try to take that for one person and multiply it to the population of your economy. That the population health management becomes a very different conversation. The analytics that you can provide from the data, the trending, the prescriptive analytics that you can derive from the data is so much more powerful. And I think that's going to be a key component. Different countries, different economies have varying levels of digitalization of data. It's very nice to see that when we did the survey earlier, that 98% or more indicated that the Philippines did utilize digitalization in response to COVID-19. I guess the question is the degree of which the digitalization happens, because I think in the Philippines, we still have a huge opportunity to pursue digitalization of healthcare. I wanted to show this slide just to give you an idea of, this was a slide I got a couple of days back, and I saw it, I thought it was very important in the US. It shows you the fastest growing and the declining jobs over the next decade. And what you will notice here, you see a lot of the blue. The blue are primarily the healthcare related jobs. You can see nurse practitioners on the upper right. And I understand in the Philippines, we're trying to take an initiative to develop nurse practitioners, which is great. If you look at the other, medical and health service managers, you look at physician assistants, you see a lot of opportunity for growth in healthcare. Why are we bringing this up? I'm sharing this with the group because I think healthcare is going to be a very key component in the next year. The pandemic that we just went through, or we continue to go through, is sort of like a reset for many of us to really look at how we see the future, how we prioritize ourselves, where we spend more time, where we spend more of our money, where we focus our energies, our resources. Here you will see that the opportunities are significant in the area of healthcare, and wanted to share this with everyone because I think it's very important that you will see a lot of development, you will see a lot of opportunities in the area of healthcare. So, and my next slide here, I wanted to get a chance to share with you, if you look at different countries and how much they spend on healthcare as a percent of GDP. These are from the OECD countries. The Philippines is not here, although the median is somewhere at about 8.8%. You have some countries spending significantly, like the US, which is pushing close to about 20% of their GDP. To the lowest end here, you have Indonesia at 3.1. I wanted to share this, and my last slide, I wanted to share with you the Philippines, where healthcare as a percent of GDP. We've been hovering at about 4.5, 4.4, 4.6% of our GDP for healthcare. Only recently in 2020 did this increase significantly, and I think many of us can associate that to COVID-19. So wanted to share these slides just to give you an idea from a global perspective, how healthcare has evolved and has developed in other countries, where we see opportunities to consider healthcare as an important component of livable cities. We think healthcare security is an important part, not only for cities, but even for our economy and our country as a whole. So again, hopefully we'll be spending a little bit more on healthcare, but I think it's the judicious way of spending healthcare where we can really make a difference, especially for the folks with limited access to healthcare. So on that note, I'll end my presentation. Thank you very much.
Thank you very much, Roger. Very eye-opening presentation. And I think all the more so because this is already in practice in the Philippines, but not for domestic patients or domestic market, but for international patients and a global market. So here we are, we're talking about, telemedicine and e-consultations, and Dennis is talking about systems and registries and databases, and Roger is talking about all that, plus the use of sensors and remote diagnostics and robots to track some vital, vital statistics on patients. No? So it gives you an idea of what is possible. And what's impressive, I think, is that a lot of these activities taking place in the country, but all for overseas clients. So you can imagine what the possibilities are for the Philippines. So Roger, thank you so much for that. And I think this will open up a lot of eyes on what can be done here in the Philippines. Thanks for that, Roger.
Thank you. Thank you.
Yeah, thank you. Okay, so we're going to move on to our next presentation. But first, I want to get back and ask a question again that takes us back to this pandemic and just some aspects of services. No? So my question is, which of the following services during the pandemic does your LGU or organization appreciate the most? Okay, and you can answer, of course, multiple answers. Just let us know which ones were kind of the ones that you appreciated the most. No, was it online payment? Was it SMS broadcast of announcements and advisories? Was it online or telephone health consultations? All of the above, or none of it ever mattered to you? So which of the following services during the pandemic, right now, did your organization or LGU appreciate the most? Online payment, SMS broadcast of announcements and advisories, emergencies, online and or telephone health consultations, all of the above, or none of the above? Okay, so it's kind of spread out, but there's a large number of you appreciated, over 56% say that all of the above. I think what's noteworthy here is none of the above. So I'm assuming that everybody had used some form of a service, a digital service, whether for health or other services, actually, emergency services, for instance, as we have for typhoons and natural disasters, and so found it useful. But again, as Roger said, it's in the degree of the digitalization, I think, that we need to be looking at. Are we scratching the surface, or are we going well beyond that? Okay, so thank you. Now I'm going to move to our next presentation. And the first thing I want to say, first of all, is wish Richard Irvine a very good morning. I know we have you up quite early, Richard. You are coming in from the UK, am I correct?
Yes, that's correct. And it's a pleasure to be with you all.
So thank you, Richard. So we're going to have a couple of presentations. Richard is going to take the lead in the presentation. Richard is from NHS Digital. So NHS is the National Health Service of the UK. And he is a data design and he works with data design and integration at NHS Digital, leads the data engineering functions. And through the pandemic, he's led the architecture, design, and implementation of data flows for the NHS shielded patient list. Now, I noticed some questions coming in about patient lists and registries, so I think this is going to become very relevant to us when he talks about NHS shielded patient list. No? So joining Richard in his presentation is Alistair Bulward. He's the head of function for analytics at NHS Digital. And over the last 18 months, he has recruited and led a data visualization team working on public and private secure dashboards as part of the COVID response. So Richard is going to take the lead in making the presentation. Then I think Alistair will come in on a video presentation, and then Richard will, of course, remain with us through the open forum to answer any questions from you. So let me now turn over to Richard to tell us all about his work at NHS Digital. Richard, over to you.
Yeah, thanks, Bill. And first of all, thanks to the other speakers. Really interesting so far. So just to give you some context, NHS Digital is part of the NHS in England and the UK, and we provide the national technology infrastructure, and we support the flows of national data. Those are usually for the purpose of research, planning, commissioning, or reimbursement to local health organisations. Next slide, please. Thank you. So what I'll cover is aspects of the pandemic and how NHS Digital responded to that, how this has transformed the way we operate, and what this has meant for our ambitions for the future. So through the past 2 years, NHS Digital has delivered a wide range of services to protect our citizens and to provide patients with the right care. These include things like the NHS Test and Trace service, which is underpinned by all the testing sites that are present around the UK. And we've also provided the national booking service that allows citizens to book their appointments for their first, second, and third or booster vaccination. But we've also supported a wide range of research studies and clinical trials, including work with the University of Oxford and AstraZeneca to support the efficacy of their vaccine. And what I'd really like to do is to just focus on one particular deliverable, which is the shielded patient list. And I picked this because I think it's more than anything, it's transformed the way we work, and it's transformed the way that nationally we can use data to pivot away from use for research and commissioning and planning into using data for direct care and having a real world impact on citizens and patients. Next slide, please. So just to give you a little bit of context about the shielded patient list in England. So this was developed at pace. It was requested at the highest level by our Prime Minister, and it was really intended to protect the most vulnerable of our citizens. And the intention was to use national data to carry out work centrally to take pressure off GPs and clinicians to individually identify those who might need an enhanced level of care. So NHS Digital already collected national data from general practice, from hospitals, and also prescribing and various other data sets. And so what we did is we brought those together, and it was underpinned by a methodology or algorithm. So a series of business rules that identified individuals who were treated for conditions such as solid cancers, transplants, severe respiratory conditions, or specific rare conditions. And later, the rules were adjusted to include age, ethnic category, BMI, and a range of other demographic features. So it was quite wide-ranging. The methodology is published. Please do have a look. I've put a link to the website. And again, it grew in complexity over time, but hopefully hugely helpful in terms of describing maybe our future direction of travel. The first release of the shielded patient list was on the 19th of March, and we identified somewhere in the region of 900,000 individuals across England. England has a population of around 56.5 million people, so it's 900,000 represented, about 1.4% of the population. And when we produced the first iteration of the shielded patient list, we We sent letters to all those individuals using their GP registration details, and we informed their clinicians or their GP that they were deemed to be clinically extremely vulnerable. Next slide, please. So just to give you context, the Shielded Patient List grew into a cross-government initiative and included services like the NHS Volunteer Service. So we, in England and in the UK, we reached out across the wider population and asked for volunteers, and we had hundreds and thousands of people who volunteered. So we harnessed their support to provide help to the clinically extremely vulnerable in their home. We organised prescription deliveries, we organised food parcels, we had priority slots at a wide range of supporting services, and the intention really was to try to ensure that these individuals didn't necessarily have to leave their home for any purpose. This is a dashboard that shows, it's provided by the Government Digital Service, which is one of our government departments, and it's a snapshot from June 2020, so it's quite early into the pandemic, and it shows perhaps some of the reach and impact of the government shielding service. Next slide. So alongside this, NHS Digital produced a range of public and private dashboards to support the delivery of the Shielded Patient List, but also to share key insights. In a couple of minutes, Alistair's going to talk to you about how we work to visualize data and how that's taken off. But for now, hopefully this gives you a view of the rich information we provided about the impact of COVID across the country, including the ability for anyone to interact with data and understand those numbers who are shielding, for what reason, whereabouts in the country they were, right down to their particular locality. And then we overlaid that with data about testing and then vaccination data. I should say that in England and the UK, we are blessed with a very mature system or information system around our nation's health. So the only reason this was possible is that we already had and collected large amounts of national data about an individual's care. So when bringing those data together, we were able to link them in a fairly straightforward way, certainly at pace. Next slide. So before I hand over to Alistair, I just wanted to share some figures to give you a view of what was involved and the impact of the programme. In particular, the use of large volumes of national data to drive care of our citizens required us to ensure that our technology could work at scale to collect, curate, and process data. But I should say it was coupled by a passion and ambition to succeed from our staff. When the pandemic hit, the impact on the working population across the world changed, but the hours and the work ethic applied by staff was absolutely incredible. I want to touch on the legacy. The Shielded Patient List is a point in time. It closed in September 2021. There's no more shielding, but it's a game changer in terms of moving population health to a truly national scale. So previously we've had risk stratification tools that allow us to identify individuals at risk, but not nationally. And the ability to bring data from a wide range of sources, to link those data, to identify, to run it through a complex methodology, and to identify those at risk in a matter of sometimes hours is something that we're now left with as a true true statement of intent as we move forward. The Shielded Patient List is underpinned by, I've talked about a methodology, but it's become a population health platform that we can pivot to any set of conditions for any given population set and it's linked to mechanisms to communicate with citizens and clinicians in a variety of forms, whether it is, I don't know, letters or SMS or email, and then going forward, we'll link it to the NHS app. As well, so it's as I say, it's a true game changer. The latest use, by the way, is that the infrastructure for the shielded patient list has been used for monoclonal antibody treatment. So it gives you a view of how we've developed one thing, and then we'll pivot to other things. And what I'd like to do now is hand over to Alistair if his video can be prepared, and he's going to talk a little bit more about our data visualization work.
Hi, my name's Alistair Bulward. I'm Head of Function for Analytics and HS Digital, and I'm here today to talk about my favourite subject, dashboards, data visualisation, and I want to talk about what we've done in COVID and beyond. So in a nutshell, just what I'd say, I think the fascinating thing about dashboards is it's where data meets people, and it enables people to go and make really impactful decisions when it's done correctly. I think population health and the pandemic has provided a lot of great use cases, some of which I'll hopefully talk about now. So I'll move on to my next slide. Apologies. I think when I look past over the last 2 years, we've grown from a very small team. So we've grown from a team of 2 people to a team of probably about 15 people. And we started off quite small. We produced a number of dashboards around 111s. That's a service in England where people can phone up when they think they may be ill. And in the early days, that was one of the only areas where we could get some sense of the national data in terms of people who may have COVID, because this was pre-mass testing. So we published that as an open data set that was aggregate and anonymous, quite early on in the pandemic. And then not long after that, we published a dashboard of data visualization embedded in our website that enabled you to see the trends of people calling with suspected COVID and look at that on a map in England as well. And that was really impactful. Our engagement, our usage figures quadrupled really when we went from just pushing out the data to pushing out a dashboard. And it enabled, public health professionals, policy people, some journalists to explore that data in a much more intuitive way. And I think that's one of the power of the dashboard that we, the first one that we built as part of the COVID response. After that, we built a lot of other dashboards. We built coronavirus in your area, had, millions and millions of hits. And that was, it's now been migrated into another platform. But at the time, a very simple app, up in the postcode, you can get the amount of COVID sort of infection rates in your area. And then also at a similar time, we also pushed out a bunch of private dashboards supporting test and trace. And the great stuff about there is we were able to build mapping dashboards that could enable somebody in public health drill down to their local authority and then go all the way down to postcode level information to identify testing rates, whether there were a large number of void tests, whether they were reaching certain areas. They could start answering questions on where they placed vans, testing vans to drive testing uptake, or identify areas that need more engagement, because again they might want to engage more, create. Get that local population to engage more with testing. And that was being used by about 75% of the local authorities in England, sort of for a good 6 months in the pandemic. So very quickly then we started building onto our secure dashboards for the vaccine programme. So this is where we were taking information that was patient level, pushing that to GP. So, we've got, 75% plus of GP practices using that dashboard currently today, and they can identify who needs to be vaccinated and then look at that by cohort, age, ethnicity, and sex. And I think then just very quickly, I'd like to touch on what we're now aiming on is I think the pandemic has been a great opportunity to build a team, a capability, a platform. So we've actually built a platform that's both can serve the public, can serve private, and also serve clinical use cases using secure data. And I think the challenge now is to reuse this in lots of other programs and create lots of components. And I think what we're now starting to do is, okay, so we built, you know, a national ability to provide dashboard to GPs. We're now using that for other programs such as GP appointments, and we're now, you know, and we've got a sort of a steady growing list of other programs that want to use that as a way to get data into people's hands so they can make a difference. And I think if we look past over the last 18 months, 2 years, it's amazing. We've gone from a team of 2 people to a team of 15 people, from serving hundreds of people to today we serve thousands, and we have served millions at the height of the pandemic. And it's a real testament, I think, to all the people in the NHS. And I think the other thing I would just like to touch at the end, this was built by lots of people from lots of different backgrounds. We had clinicians feeding into this, we had designers, we had a lot of people from Goldman Sachs came and helped us out from a technical perspective. And I think what the pandemic really proved is that badges off, solve a problem, and then sort of scale it. And I think that's been fantastic, and something hopefully we won't lose going forward. That desire to try and solve a problem for the public good, really. So that's it. If anyone's got any questions on dashboard or data visualization, some of the work we've done at NHS Digital, please get in touch. But I'm sure Richard Irving can take questions on the call. Thank you very much.
Okay, thank you, Richard and Alistair, for the presentation. I think you're right, Richard. You know, I guess one advantage you had is that you had this very mature database system already in place, whereas ours is kind of a little bit all over the place at this stage. But it's something good to see that we can aspire to. And I noticed you mentioned something about you could track everyone down to their GP registration. So am I to assume that every person in England is connected somehow to a GP, and that's how you can start getting the records together? Is that the way it works?
That's mostly correct. So with the exception of maybe 1 or 2%, everyone has a registered GP.
Okay.
I should say we do have some gaps in our data. You know, we don't have data about everything, and our flows of hospital data have been in place for about, I don't know, 25 years now. But we've supplemented that with other flows, so primary care prescribing. During the pandemic, we were able to secure a flow of data from general practice, from GPs. So every patient's clinical record was brought to centre, but that's only something that we're permitted to do during the pandemic, and that period will run out soon. So there are still some items that we need to tighten up. And another thing, so we don't get the hospital prescribing record, and so we've still got gaps. So you know, don't be disheartened that we've got everything we need. But the pandemic, you know, as Alistair mentioned it in his video, that it was badges off. It was a time when, or through the past 2 years, data engineers and analysts have worked hand in hand with clinicians. And what we've done is we've described a future landscape that we're not going to go back. And what the public see is the rich ability of data to drive care. And that's really changed the public perception around some of the privacy rules and laws and legislation that have been sort of underpinning the capture and curation of data for a long time.
Mm-hmm. Great, thanks. Okay, that's something we're going to get back into later on. First, I'm going to ask a question, and then I'm going to move to our last speaker. And so you'll notice in our presentation earlier, we talked not only of, you know, e-consultation services provided, you know, via an app, but we actually talked of LGUs, or an organization for that matter, but in particular LGUs with e-consultation services. And I think the examples were given of Sorsogon and Kawayan, Isabella. So let me ask this question first before I introduce our last speaker for this afternoon. Does your LGU or organization have e-consultation services? Yes, no, or I haven't heard of it. You're not aware that if your LGU has one. So just think of the examples of Sorsogon and Kawayan. As you know, they have it, the sort of a virtual doctor service that they can call in all the way to the most remote area. So does your LGU or organization have an e-consultation, a medical e-consultation service? Yes, no, or you haven't heard of it, you're not aware of it? Okay, this should be interesting to see what the answers are like. Oh, okay, this is interesting. 39, it's pretty well split, 39%, a little over a third say yes, they have it. 31% say no, they don't have it. And 31% haven't heard of it or not aware that if their LG or organization has it. So clearly the practice has started, but there's obviously a lot of room for growth and expansion. And there's probably clearly still a need, even though we see the COVID cases begin to drop and we are moving ever so slowly down the alert level numbers. But obviously we still need to be careful and you know, learn to live with COVID or whatever comes along our way. Okay, so let me move to our last speaker, and I must tell you that he is one of the mayors I happen to enjoy really working with through this whole pandemic period over the last 2 years. You know, Mayor Lino Cayetano has been the mayor of Taguig since 2019, and I guess just his luck, he became mayor and COVID came along in 2020. But it's not his first time, obviously, in politics or in government. He's a very hands-on mayor, and of course, he started as a barangay captain back in 2010, and then was later and served as congressman of Taguig for the 2nd District of Taguig in 2013. So he was active already in government office since 2010, and then as a congressman, but became mayor. And a mayor is a different type of executive. It's a chief executive of a city, you know. And under his direction, Taguig has been recognized by the Department of Health and the Department of Interior and Local Government for becoming a model city to other local government units through its successful pandemic response in testing, treatment, and society reintegration and vaccination. And my experience in talking often with Mayor Lino is that he is one of those mayors who really makes use of data and data analytics to manage the public health situation in his city. And I think, just like Richard said, this is kind of a meeting of the minds of clinicians and data analysts and data scientists. And I would add here the merger really of the convergence of clinicians, data analytics guys, and of local government leaders like Mayor Lino. And so he's always, you know, shown us such a great way that he manages the city in terms of the data he collects. And so I thought of inviting Mayor Lino because I think that many other cities and all of us, even in private organizations, can learn how someone uses data to manage the public health situation. So it's my pleasure to introduce Mayor Lino Cayetano of Taguig. Mayor, the floor is yours. Mayor, I think you're on mute, Mayor Lino.
Ang populasyon po natin sa lungsod ng Taguig, kumikit-kumulang, nasa 800,000 yung populasyon ng lungsod ng Taguig. So ang sabi ng mga eksperto dito at sa ibang bansa, anywhere from 5% hanggang 30% yung pwedeng mahawa sa sakit ng COVID-19. So 5% ho ng mga Taguigenyo, that is 40,000. So 40,000 ang maaaring magkasakit kung 5% ho ang mahawa. Sabi ng ibang eksperto sa atin, hanggang 30% kung hindi tayo susunod dun sa quarantine procedures. So 30% of 800,000, 240,000. So ganyan kadami ho ang pwedeng magkasakit sa atin. Ngunit ang COVID-19 ho, hindi naman lahat ganun kalakas ang tama, ang epekto. In fact, hanggang 86% sa mga magkakasakit, pwedeng magpagaling sa kanilang bahay. 86% ho, yun yung datos mula sa ibang bansa. Malaking porsyento, kaya gumaling. 86% ay pwede sa bahay. So 14% ang kailangan ma-ospital. So 14%
5,600.
ng 40,000 is 5,600. Sa 30% ang mahawa ng populasyon natin, 240,000, 14% of 240,000, 33,600. 33,600, ganyang kadami ang pwedeng ma-ospital. Kung tayo naman ay susunod, 5% o mas mababa, pwede pa rin umabot ng 5,600. Ngunit ang malungkot.
Thank you, Bill, for the introduction. We wanted to start with that very crude video that we shot in the first few days of COVID. That was a time when a lot of us didn't know much about what we were dealing with. In fact, the entire world didn't. No? There was not a lot of information coming in. But we shot this video to help guide and to help give confidence to our citizens. Even our equipment at the time was not readily available because the whole Metro Manila was in down. And I look at it now, I recommend that we downgrade our alert status to alert level 1, meaning, we're a step closer to really, the new future, the new normal. And sometimes we forget how far we've come. And to me, that video is an example that even early on, Taguig has tried to make decisions based on data and information that's available. So when the National Capital Region went on lockdown, a lot of the focus and the concern was on enforcement of our rules. So a lot of you were probably here when there was a lockdown. It was about checkpoints. It was about curtailing mobility. That was what the focus was on. But in Taguig, a lot of the focus of the preparation while we were doing enforcement on the ground, that it was also gone into purchasing test kits and all that. And everything we did that led us to where we are now was because we relied on the available numbers. So later on, I'll go a little bit into that. But before I get into our COVID response, the city of Taguig, I was blessed that, yes, I've been mayor for 3 years, but when we started, Taguig City was actually already on the way to really becoming a city that relied heavily on data and analytics. I'm sorry, let me just try to quickly go to the beginning. So in 2010, I think that's where it all started. When we talk about data management, data collection, it all begins with, do we have an existing framework? Ano yung mga mekanismo natin so we can extract that data? So to us, at least when it comes to healthcare, it began with fixing our health centers, our barangay health centers. The barangay health centers are often overlooked. We talk a lot about our hospitals, but in Taguig, we really believe that our barangay health centers are really the foundation of our healthcare. And I think more so with the transition to universal healthcare, more and more people are becoming aware of that. We had 3 PhilHealth accredited healthcare centers.
Excuse me, Mayor Lino.
Yes.
We can't see your screen.
Let me.
It says share
Sorry
screen, but
about
we can't see the slide. It's okay.
Do you see it now?
It hasn't come up yet. It just says you've started screen sharing, but we can't see the picture.
Okay. One more time.
No, not yet. Jonah, do we have a backup copy with us? Oh, there you go. Okay, now it's showing.
Okay.
Yep,
Sorry about that.
Barangay Health Center. That's okay. Got it.
Yeah, sorry about that. So just wanted to take you quickly through the process because it's easy to talk about data and analytics, but the hardest thing to do is gather that data. So the first thing we did was really the foundation of all of this is fixing our health centers. So from 3 health centers within the next decade, we now have 31 PhilHealth accredited health centers. To us, that's very, very important. When it comes to data collection, data management, the Barangay Health Center now serves as the base of our barangay health workers. Aside from that, it's the base of our TCISS. So Taguig has an in-city integrated survey system. We have people who are employed by the city government who go house to house and do a survey of what people need. Next is the digitization of medical records that is barangay-based. And lastly, we made sure that all the barangays are Wi-Fi connected for proper reporting. So because of this network, Taguig pioneered about 6-7 years ago delivery of medicine to our citizens. So that also helped us now because we've targeted already the vulnerable. So in the city of Taguig, we deliver medicine right to your door. More than 60,000 a year. Taguig citizens receive free medicine. A large percentage of those who end up hospitalized or die is because of lifestyle diseases. So we focus on hypertension, diabetes, asthma. So this is something we've been doing before, before the digital migration. Somebody goes to your house, they check, and then we collect the data, and then we have a system, and then once you're in the system, we deliver the medicine every quarter. That's good for 3 months. Another program that we do in the health center is the partnership with I Can Serve. It's a seminar for breast cancer. Again, the data served us, and we're able to execute the pandemic. Now, everyone was talking about this. In 2019, our bench conferences, our seminars for those we pull in to talk about breast cancer, we did 66,000. In 2020, we did 9,000. Those that actually screened, 36,000. Those with findings, 1,100 in 2019. In 2020, 532 births. Is that a lot less people were screened for breast cancer. And this is just one aspect, one other problem. So right now, I'm going to try to explain by giving a few examples. How Taguig, we can talk about a lot of health problems, but we'll try to focus on the pandemic and then do some case studies about how our data and our analytics help guide our action or our policy. So first of all, you're familiar with this Bill, our trend team. So the trend team is a new office. It was put together around the end of 20. It's a group of 8 20-year-olds, and they diligently collect and analyze data for us. Traffic management, environmental services. The city health office, they're required to collect data that helps the mandate of their office. Now this data is submitted to the trend team, and they now collate this and analyze it. So number one is really because we have an office that's only job is to collect and analyze data. It helps us. Let me give you an example of the kind of data that I receive every day. So that's something that is updated daily. Okay, so aside from this, they do localized data. We don't just give reports on the situation of the city, but we also go into. So this helps us have a more localized approach. So each barangay has a profile of who's sick, has its own case fatality rate, and it helps guide policy further down. So just like the national government can guide properly if they give us correct information about what's going on in Cebu, what's going on in Manila, what's going on in Taguig, we do this also for our barangays. So our barangays might have different peculiarities, and the data that we give on a localized level to enforce policy better. So we give this and we submit it to the barangays every day. Another thing we do is we meet every day. No, it's the Executive COVID Command Center. Having data is good, but if you don't analyze the data properly and you're not surrounded with people who understand the data, then oftentimes it becomes useless, or even worse, it serves the purpose that you want without really understanding how it will address or if it will address the problem. So in Taguig, we have this data, but every day at 12, we meet the experts. So these are doctors, these are our medical director, the director of the hospital. These are members of the Sanggunian. This is the command center, the chief of police of Taguig. These are members of the Safe City. So these are people that when we process the data, they're able to give input. So we start this meeting every day at 12 o'clock by going through our data for the day. It takes about 8-9 minutes to look at all the slides. And if there are things that jump out, like a lot of enforcement issues in one barangay, then we speak up and we try to address it immediately. So this is an example of our dashboard. What's good about the dashboard is in a matter of a few minutes, we have an overview of the entire city, particularly how the private and the public hospitals are managing or are coping. So let me give you an example. This was during the Delta surge. So every day, we already see how fast St. Luke's Medical City or TPDH, that's our local hospital, how fast the cases are rising. We also see our quarantine facilities. You know, we have a lot of quarantine facilities. Sometimes it gets full. Sometimes cases are high, but we have a problem convincing people to go there. So when we look at this, then we are able to address the problem better. So I remember during this time, there was a surge, but our quarantine facilities were not full. So we addressed it by engaging the community and telling them how comfortable our quarantine facilities are. We also see on a daily basis how we're doing with contact tracing. So that's a everyday 10 o'clock meeting. We talk to all the contact tracers and we go through every single case. That data is submitted at 12 o'clock and we analyze how many of them are tested. So as you can see, I have two examples now, one from Delta, one from Omicron, because it's significantly different, and I'll talk a little bit about it later. And that's also an example of how it's important to look at a lot of different data points. So we also record like general areas where we see a lot of transmission. If you look to the right side, work, transportation, hospital, resorts, park. And then we have that also specifically with our enforcement team, so that we can engage them with our Safe City team and we can capacitate them to check if there's transmission in those areas. So because of this, so our problem at this point with our two examples was hospitalization, particularly during the Delta surge. So because of that data, we were able to cases were mild and moderate. So that's where we did that's where we engaged and we tried to push for our in Taguig, all 31 health centers, the barangay health workers, which we have around 800, can talk to the doctor. It can be a video, but if not, then we will do it with a telephone or your tablet. Next, because of the data that we saw, we realized that a lot of our citizens, especially early on, wanted to be in facilities, even if their cases were not moderate or not severe. So that also helped us double down on a lot of our quarantine facilities. So we built quarantine facilities. We transformed some areas into quarantine facilities. Eventually, we rented hotels. So right now, these are all being repurposed as MSME stalls. So it will be a beautiful park for a small business. And we are now renting hotels so that it's more comfortable. So all of this were decisions that we were able to engage early on because of the trends that we saw using our data. So another question during the pandemic or throughout the last few months was, how can we expand vaccination? Meaning, how can our numbers get higher? Because the National Vaccination Operations Center constantly pounds us and looks at our numbers. So now our numbers are very good. But there was a time where it wasn't. But it's very difficult when you don't go into the details of the data. So in Taguig, thankfully, again, all our data is analyzed and scrutinized. When we looked at our vaccination of seniors, we saw the areas where there were low vaccination for seniors because we do an analysis of every hub and we do an analysis of every barangay. So sometimes it's difficult to do a blanket policy when there are problems in specific barangays or specific areas. It might be that the vaccination center is too far. It might be that there's hesitation in the community because there's a leader of the community that doesn't want to be vaccinated. So every day, so this is an example of the microdata we do. This is how we monitor our seniors. So nakikita ko. So like on June 7, I asked them, why are we down? On June 9, I asked them, where are we down? So during that time, June 7, 8, and 9, I'm sure we were mobilizing. I'm sure everyone was trying to figure out how to get the numbers back. And we did. In June 10, 11, 12, 13, 14, we went back to 3,000, 4,000 a day. It went down again, and then it went up again. So looking at this data every day allows us to enforce or allows us to look at the data properly so that we can put together programs to address the problem. We also do a per barangay. So then we look at the nuances of each barangay and each issue. So let me give you a problem and how we addressed it. The barangays that have low vaccination, what we did was we brought our vaccination bus there. So this is an example of one of our barangays where we brought the vaccination bus. A lot of the barangays were able to increase by 5 to 8% just by going inside the community. Sometimes it's not enough because Metro Manila barangays are so big that we just have one hub. Sometimes we really just need to go in to make it easier for them. This is how we addressed one of their problems with senior citizens vaccination. We opened our own senior vaccination center. So it's a vaccination center where we really designed it for senior citizens with ramps, and even the restrooms had handles. So they felt very comfortable, and everyone knew that it was seniors that were using it. Another thing that we do with our microdata is sectoral. So geographical, sectoral, and then with our sectoral data, like in Taguig, we have around 1,000 registered farmers and fishermen. So we also targeted vaccination for our farmers and fishermen when we saw that it was relatively low. So again, the data properly analyzed results in programs, direct programs that will affect that particular group. So lastly, now as I close, the last question was Omicron. There was actually a lot of debate during Omicron, Bill, if we should close down. And I know you were part of that discussion. And a lot of us believe that we just needed to enforce the vaccination mandate, get people vaccinated, and we can get through it. But if you saw our numbers, if you look at our numbers only, number of cases that the news often reports and the news outlets often echoes, you'll think we'll need to shut down because a lot of times our cases were double that of Delta. So here's a graph of look how high Omicron was compared to Delta. So if we were looking at our data, but we were only looking at reported cases, we would have probably shut down. And when you shut down, obviously, you know, livelihood, jobs, you lose confidence, our people loses confidence. But this other data point, which is utilization of our beds in our hospital, shows that it had a very different effect. Because of vaccination, our hospitalization was very low. These are our numbers per month. And as you can see, January, February was very low occupancy in our hospital. Taguig, in general, is doing relatively well in terms of deaths per 100,000. Case fatalities is at 0.72, relatively much lower than the NCR average. Then to give us also a perspective, what we do in Taguig is we also look at other cities. In this case, I put international cities for you guys to see. Our deaths per 100,000 is at 48. National Capital Region is 108. Singapore is 17. But London, Los Angeles, New York is significantly higher than Taguig or than NCR. We also look at all other cities around the world. This is good because when you compare policy, sometimes it's not apples to apples. No, there can be good programs and policies are different, then it's not necessarily applicable. So I'll try to fast forward, Bill. No, but just to show you and maybe to give some confidence to everyone, look at our case fatalities and our deaths. Our case fatality rate now at in 2022 is 0.25% in Taguig. Our deaths in the upper right-hand side is down to 24. Same cases as 2021. And our deaths are down to 24. With Omicron, we've focused on therapeutics and we've tried to veer away from any more lockdowns. The shift now, because again of the data we have in our hand, is really we can open up and we're confident that we can open up and we're guided accordingly by the data that we have. So what information and the data you have when you make decisions. And so far, it has led to Taguig being one of the safest cities, at the same time being one of the most progressive and aggressive in opening up. Thank you, Bill.
Thank you, Mayor Lino. So I think what you're showing us really is that, you took not only a city data, but you use your barangay health centers all the way to get down to barangay level. So it's extremely localized data. So you can make adjustments on a per barangay basis. And I like how you even make adjustments on a per age group, basis, like the A2s, the seniors, and so on and so forth. So really excellent work. And ladies and gentlemen, I mean, one of the reasons why many of us in the private sector like working with Mayor Lino is that he's such a data geek, that we all get around the numbers and we come to the same ideas and solutions quite quickly because it's just based on numbers that we see. So it's excellent. So thanks for that, Mayor Lino. Okay, it's time for the open forum, and I want to just get all our speakers back on screen. Dr. Dennis Batangan from the lead for the UK Better Health Program in the Philippines, the digital lead. Grace Anduiza, the Chief Revenue Officer of Consulta MD. Roger Salazar, the trustee for Health Information Management Association of the Philippines. Richard Irvine, Associate Director for Data Design and Integration for NHS Digital, and Mayor Lino Cayetano of Taguig City. No? And first of all, thanks for joining us. Thanks for your presentations. We've really seen a kind of a full spectrum of what can go on. And I also want to thank you for so actively answering all the questions in the Q&A box, because that's what really helps us keep the whole program running on time. So thanks for that. I have a question, I think, that's always in the back of people's minds. We're talking of data portability, of health information, of sharing of medical electronic medical records. Now, so I think what might come into people's minds is that how does the data all remain confidential and private between a person, a patient, and a doctor or the hospital, as the case may be? Who would like to take a first crack at that? Or maybe Dr. Dennis, let me start with you, because you're working on a whole system. So how do you ensure confidentiality?
Yeah, thank you, Bill, for the question. Actually, there are specific guidelines from the National Privacy Commission, and in the case of health records or health, the Department of Health. Well, it actually starts with the institutional policies of the facilities, no, meaning the institutions, health facilities, should actually follow the guidelines from the National Privacy Commission. And one of the key elements is having a data privacy officer. And the data privacy officer actually institutes all these different, because it's very complicated and it's already regulated, no, because of the Data Privacy Act. So the best way to do it is actually to follow this. Of course, there should be monitoring of these different policies and guidelines, no, being implemented. But I think one of the basic things is actually the people who are handling the data should be aware of the risks, no, of handling data. So that's very key, no? Meaning the individual healthcare provider should be aware of the specific roles and also the risks and penalties, because there are already penalties for data breaches. So that's, I think, part of it. But maybe it's another livable city forum, but to discuss data privacy and confidentiality. Yeah.
Great. Thanks, Doc.
I think, yeah.
Thanks, Dr. Dennis. Grace, let me ask you. I mean, you said you've got about 1 million users, and you're taking consultations. You're referring people to hospitals, presumably. You've got prescriptions going. So you're tracking a lot of data. So how do you handle all that and keep respect data privacy and patient confidentiality?
Anchoring on what Dr. Dennis mentioned, we are always mindful and we always keep ourselves updated on the policies or the current policies or any changes they might have on data privacy, just so we are compliant at all times. And we do have a data privacy officer that keeps us in check to make sure that we not just the employee, we are able to maintain the integrity and the confidentiality of the data that we collect from our patients.
Okay. Roger, I mean, I suppose in your business, the BPO side of things, there must be very, very strict rules regarding, of course, on the one hand, you have data portability. On the other hand, you've got a lot of sharing. On the other hand, you've got to keep everything private. What rules apply for the BPOs and how do you go about that?
So thanks, Bill, for the question. I think our case may be a little bit different because it's the United States, which is our major client. There are many laws. There's what they call PHI, Protected Health Information. There's HIPAA, which is there to protect the law. And one of the things in the US, the Patriots Act, while we in the Philippines get to work on healthcare data of Americans, we cannot store the data in the Philippines. It will have to be stored stateside because it's a matter of national security. When another country gets access to your national healthcare data, that's a big security risk, right? That's a very big security risk. So what we do is we have huge internet pipes where the data comes in, we work on that, we process it, but then all the data goes back to the US after it's worked out. None of the data is stored in the Philippines when we work on it. So that's one security feature. And the other thing is, of course, we've all learned about cybersecurity and all of that. So that we have a lot of firewalls, we have physical, digital, different kinds of security measures in place to protect healthcare data. And there are very huge penalties in the United States for every occurrence of breach of data. And it runs into the thousands of dollars, tens of thousands of dollars per breach.
Per breach, yeah.
Per breach. And one breach could lead to many, especially if you have many members. So you can just imagine the liabilities that will result out of that. So next to the services it really is regulated is the healthcare industry because of the protected health information data. So when patients or members participate in a healthcare plan, they normally sign a consent form that allows the data to be within that organization and it's being used by that organ. There's a consent form that is required of them. So, but nonetheless, these institutions maintain healthcare data, the integrity of the data because of all the laws that they have to comply with and abide and adhere to from the national government. Bill.
Yeah. Thanks, Roger. Mayor Lino, I have a couple of questions for you. Well, one is a comment and then followed by a couple of questions. One, it says that, and I'll quote, "Love the data-driven governance approach of Mayor Lino." Now, do you also provide or do you have plans of making your reports or dashboards viewable to the public so citizens can see outcomes in real time? And do you have plans to harness artificial intelligence to enhance your data analysis and augment your team for swifter analysis? So make it public and AI.
Definitely, Bill. Go to I Love Taguig on Viber. You can subscribe. Go to Facebook or Instagram, I Love Taguig, to tagiginfo.com. So tagiginfo.com. As much as we can, we have all our data there. Then we're trying to just filter how better we can present the data in a way that can be appreciated by the public. Now, for example, some of these hospitals are private hospitals. So instead of showing that, we're thinking of adding the number of COVID beds and just saying the private and public hospitals in Taguig have 22 out of 200 beds occupied. So we're trying to go through the data, especially now moving towards the new normal, to protect these private establishments and institutions, but at the same time present data where people can feel confident and can analyze better. Using artificial intelligence, yes. Some of the things that we wanted to do are also like automatic alerts, signal number 1, number 2, number 3. So now we have a tower, which is an environmental and weather reporting system. So Taguig has its own activity, then it sends a warning to the barangay captain for possible dengue. We have air quality monitors in multiple stations in the city. So we report it now physically, but there's no automatic report yet. But eventually what we can do is that when it's on higher dangerous levels, then it messages those key stakeholders. But definitely it's something we want to utilize moving forward.
Great, thanks. So I hope all you folks from the UK Embassy were taking note of Mayor Lino's website, Facebook page, and all that to get your real-time information as you are, I believe, resident right there. Your embassy is resident right there in Taguig, so very important. Thanks. Now, I'm sorry we've run out of time, but I want to thank the speakers first because, you've been just so actively answering all the questions on the Q&A box. So I really want to thank you for that. And I also want to tell all the participants that please go to the Q&A box because they are answered, and you can download those as a matter of reference. And because we're going to be here, for quite a bit longer if we had to go through all the questions. No, let before I close, let me just give each of our speakers about a minute. Just give a summation or what kind of last thought would you like to leave behind with our participants in terms of digital health and improving health for all into the future. And Grace, let me start with you, ladies first in this panel.
Well, thank you for having us and letting more people know about Consulta MD and how telemedicine or telehealth is fast becoming a need of everyone because of physical distancing or people really trying to avoid certain places or getting into crowded places. And we also want to encourage everybody, like what I mentioned earlier in my presentation, to not just focus on your physical well-being, but also focusing on your mental health. And with that, let me remind everybody if you can download the Consulta MD app, because we're giving out mental health vouchers that you could try out. This is for a free consultation with our licensed psychologist. And Mayor Lino, maybe we can work together with the MD on how we can probably move forward with, how we can improve. Ang galing ng system na ginagawa mo is very data-driven, and it's something that is of interest to us. So it was great to be part of this panel. And also, of course, Sir Roger and Dr. Dennis.
Well, Grace, it'll be good of you to expand the relationship with Mayor Lino because AC Health is already there working with Mayor Lino because he provides their vaccine sites. Right in Taguig. He's got several of them running there. Dennis, any last words on your side?
Yeah, thank you, Bill, and thanks everyone. I think last December, we had this master class at the School of Government, and we had former Senator Orly Mercado, and one of his statements on observations during the COVID was the COVID situation actually showed us the need for digitalization. We can't and then he said that magkaiba yung computerization sa digitalization. No? Kasi minsan daw, some people think pagka may device ka na, meron ka ng may computer ka na, that's it, no? Yung digitalization actually is a much longer and much difficult, longer process, much complicated na process. And it's a long process that we have seen in the experience of the Philippines. For the initiatives with the British Embassy Manila here in the Philippines on the Better Health Program, we developed actually a new electronic reporting tool for non-communicable diseases, because this is the problem that we will be facing in the coming years, non-communicable diseases. That's why we developed this electronic reporting tool that we want to link to this bigger exchange of information. I think the direction now would be more along those lines. May mga bigger platforms, but there are different technologies that needs to be integrated into this open and bigger platforms. So we hope yung contributions namin in terms of inputs this afternoon help us in better understanding this very, very complicated situation that we are discussing at the moment. Thank you very much, Bill, and the organizer.
Yeah, thanks, Dennis. You bring up a good point. We've been so focused on COVID for the last 2 years, we've forgotten about all other diseases, including the NCDs. So thanks for that reminder. Roger, what about you? Some last thoughts?
Mine, Bill, thank you again for the opportunity to be part of this panel. Many thanks to my fellow panelists here for interesting conversation. I just think digital health is going to be very important as the way forward. More importantly, for many of our Filipinos in the islands that do not have access to healthcare. That's one. Secondly, also for the quality of healthcare. When data is digitized, it can be shared with the experts, and with the use of analysis and analytics, it becomes even more accurate and it becomes even better. So it's not just, it's a combination of faster, better, and cheaper. So I'll just leave it at there. And I know Dr. Dennis talked about platforms. I think a platform is going to be very important for all of us, a common platform like you have in many other countries when they have national health systems. That's going to be very important, Bill. my last one. Thank you. Thank
Great.
you.
Thank you, Roger. And the last but not least, the very much admired data geek of a mayor, Lino Cayetano. Lino, any last thoughts you'd like to leave us with?
Yeah, Bill, sorry, I think I'm going in and out, but I'll use the short time to address one of the questions I see on the board. No? Unfortunately, that barangay guys are tired of excuses from us in government. So I will reach out to that barangay and try to figure out what's going on. On that note, government should be solution oriented. No, I'm not an expert in data management, in data analytics. I'm no expert in IT, but I think everyone in government should be experts in trying to find solutions. And really, what led me to greater appreciation of data analytics is that it provides solutions. It takes away the bias, whether you're afraid or carefree when it comes to COVID. Appreciate it even more. And I think it's really the solution, not just to healthcare, but a lot of issues in government, to look at the numbers, be transparent with the numbers, and make decisions based on those numbers and the analysis of experts and not politicians. So thank you, Bill. Yeah.
Thank you. Thank you, Lino. One of the things I like about Mayor Lino and some of the other young mayors is the way they have hired really young 20-something data analysts to work for their city, for their LGU, and I think that's really helped all of us tremendously. So thanks for that, Mayor Lino. So we're about to close now, and I just want to maybe just a few reminders. There is a feedback form when you leave, when you exit from this meeting. It's also available on Facebook on the QR code, and you can download the Consulta MD app, but there's actually a question or a set of questions in the feedback form which will allow you to get the vouchers and match up with the app, and so take advantage of those free mental health passes on the Consulta MD app that you can get by answering the feedback form. So thank you for that. I'd like to thank our partners, starting with British Embassy Manila, because we've gone through this in both the Healthy Cities and a Sustainable Future series. They've brought together such great speakers from the UK or from British companies to join us, together with mayors and local organizations and companies. And I think this, we've really benefited from this great exchange of discussions and ideas and insights. So thank you for that to the British Embassy. And at this time, let me call on Ina Murillo, the head of the prosperity programs at the British Embassy here in Manila, to formally close this program. Over to you, Ina.
Thank you, Bill. Good afternoon, everyone. From those still joining us and extending their homes and offices in our virtual discussion this afternoon. I was especially happy to see those dialing in as far away as in Mindanao province is about 11%, if I got that correctly in the poll earlier. It is wonderful to be connected virtually. Our platform for discussion now, complete with the interactive polls and the immensely relevant topic of digital health, really do underscore how tech provides a great opportunity to democratize services and make more accessible opportunities for increased information, frontiers such as this session. I'm Ina Murillo. I'm head of the Prosperity Programs, the UK's socio-economic development platform, which covers health, education, infrastructure, economic reform, and low carbon growth. We are extremely honored to be supporting sessions like this through our longtime partnership with Bill and the Livable Cities Challenge team, who have tirelessly redefined learning platforms over this pandemic. I'd also like to extend our gratitude to our panel members who enabled such a rich exchange on digital health from an array of perspectives. From Dr. Batangan's excellent presentation on the UK's Better Health program, with digital health and improving local health systems coming hand in hand in an effective and sustainable pathway. to Grace's fascinating Consulta MD, which is a partner telehealth service of the DOH that literally brings medical advice, including the highly relevant mental health support at your fingertips, to Roger's compelling discussion of global healthcare system integration through digitalization, including an insightful comparative snapshot of prioritization of health across countries, with the Philippines moving nearly a full percentage point in recent months. To our friends from the UK NHS Digital, Alistair and Richard, who shared with us innovations in the UK where research, analytics, data design, and integration have supported effective provision of data for direct care, as Richard describes, in functioning dashboards where data meets people, as Alistair rightly puts. And to Mayor Cayetano, I am currently in Taguig now at the British Embassy, for sharing with us such an insightful walkthrough of an actual live digital health specimen in action, with Taguig's example of effective use of medicine delivery that targets the most vulnerable and has expanded even more in this pandemic. It is very reassuring to know that Taguig is at the forefront of such innovations. We are very grateful to the League of Cities and to each one of the 230 participants who have joined us this afternoon. That truly calls us all to action within our own spheres as local policymakers, health practitioners, and citizens who care and want to see beyond the present frontier and demand more effective healthcare delivery. My main takeaway really is how much of a game changer technology is in bringing quality healthcare to everyone, particularly underserved communities. Digital health in all its grand and full technicolor of possibilities provides us all a real opportunity to bring global communities closer and bridge the much needed support to those most in need. This includes an elderly in a far-flung barrio, to a doctor giving quality medical advice over the phone, and all of this enabled by local government units that can multiply this real-world impact a number times over. Digital health creates tangible hope to many citizens, acutely felt now by so many people in this pandemic. Enabling that vision of tangible hope is a strong multi-stakeholder approach. I think a number of those who are joining now form that community. It is not enough to have the data on hand or the technology in place without the commitment of the community that add value to the numbers. The pandemic has stretched so many of us, individuals, our health systems, our already limited resources. But now that we claim a better normal for all of us, the passion, well-directed ambition, and tireless commitment of so many individuals make these same challenges the enabling agent to accelerate solutions, including in harnessing quality and reliable data and secure technology. The partnerships across different sectors have driven pandemic recovery strategies, including with local governments, Taguig in particular, and through development programs such as the UK's Better Health Program. And we are very confident that these initiatives can continue to encourage more forms of collaboration towards our better normal. This Healthy Cities project, our humble effort to support the wider discourse to enable health systems, includes this three-part webinar as a joint collaboration of the UK's Better Health Program, Global Future Cities Program, and of course, the LCC. This cross-disciplinary partnership has helped deliver the UK's commitment to support COVID recovery in the Philippines, which we celebrated in the recent economic dialogue. The final webinar of the three-part series will be at the end of March, and we hope to engage meaningfully again with this over 200 virtual community who are agents of change in your own respective fields. Thank you once again, Bill, and his LCC Dream Team, Michan, Mal, Patrick, and the rest of the gang, Liz, Cherry, and Kara from our embassy team, and again to each one of you for the tangible hope and exciting frontiers you have generously shared and bring to so many people. Maraming salamat at magandang hapon.
Thank you, Ina.
It was once all about the race. If you weren't ahead, you were out of the game. But when everything stopped, we saw the chance to change the game and begin a new path. This time, the bottom line won't be our finish line. This time, we'll chase investments whose real interest is care. This time, every step we take doesn't just change the world, but protects it. This time, our tech advancements will propel human betterment. This time, we will run the longer race, because the most rewarding pursuit is leaving a world greater than what it is.
Hey guys, if we could turn on our videos and maybe have one quick photograph. Are we all here? Dr. Dennis, Ina, Mayor Lino, Grace, Roger. I think